So we're going to begin with workshop 1 this morning, which is based on ventilation. And we're going to be led through this by Hilda Palmer from the Hazard Campaign. Hilda has worked at the Greater Manchester Hazard Centre and the Hazards Campaign now for over 30 years. She's currently the facilitator of Families Against Corporate Killers. Hilda is a biologist, an ex-teacher, and is currently focused on better workplace ventilation for COVID and beyond. Her interests include toxic chemicals, trade union clean air network, and sex and gender sensitive health and safety. So Hilda, thank you so much for joining us this morning, and I'm going to pass over to you. Thank you.
Thank you very much indeed. Can you all see my slides and hear me? Is that all okay? Has that bit worked? Okay. Thank you very much to Wayne and Sean and Heidi for inviting me. I've got a lot of slides, but I'm going to skip through them. And the reason there are a lot and the reason they're quite dense is that I've tried to reference everything I say so that you've got proper source material and you don't have to keep coming back and say, you know, where did that come from or what did you say? And there's my contact details there at the bottom. Okay, so first of all, ventilation, what is it good for? Well, it's good for health. And before COVID, ventilation in our classrooms and in our offices and other workplaces was absolutely appalling in most cases. And now, of course, it's very, very dangerous during COVID. And after COVID, it will still be important. So, you know, ventilation is essential for health. It's essential for concentration and learning and attainment, particularly in schools. And now it's important for getting rid of COVID. The air in our classrooms, our indoor air, is actually not great. It's contaminated often with traffic pollution. The levels of pollution inside classrooms can often be higher than outside because it gets trapped. It's got fungal spores in it. It's got, you know, bacteria and viruses, colds and flu, and now COVID, pollen, volatile organic compounds from cleaning products, personal care products, from off-gassing from the MDF furniture. There'll be formaldehyde, there'll be flame retardants from the fabric in the upholstery and in the IT equipment, and there'll be stain resistors, there'll be microplastics in our clothing and in the carpet. So all of these sort of things will be in the air as well as COVID. And when we breathe, we take oxygen out of the air and we add carbon dioxide to it, and that builds up in poor ventilation. So poor ventilation is exposed, it's made visible by increased carbon dioxide. That's why carbon dioxide is so important, because it actually makes poor ventilation visible. It's hard to measure ventilation, but we can use increased CO2 as a proxy measure. But there's a lot of research that shows that as carbon dioxide increases, even at levels below 1,000 parts per million, and pollutants, particularly the small particles, the PM2.5s, which I'm sure you will all hear about in terms of environmental pollution, and for which there's no safe level of exposure. Recent research has shown that as those increase, then people's concentration and cognition, their thinking ability and their attainment actually goes down. And so for every amount of CO2 and pollutants that you can actually reduce, you can increase the learning and concentration. So that makes ventilation very important anyway. All ventilation is the airflow, and it dilutes, disperses and removes. It brings in fresh oxygen with less carbon dioxide, less pollutants, hopefully cooler and drier air, and it's better for us all. Okay, so that's why we're doing this. Now, what I'm really trying to get across today is hands, face, space won't cut it. COVID is in the air, COVID is airborne. We have to ventilate, we have to clean the air, not the surfaces so much. Workers, we feel, should be wearing PPE to FFP2, FFP3 standards. I'll develop all these informations. Students should be wearing source control masks everywhere indoors, and we need the multiple layered control measures. There's a picture of a fact sheet I wrote for Hazards magazine last year and a link to it. You can use that, you can stick it on your notice board, you can use that to summarize the issues and send that round to people. There's a link to an HSE video on ventilation and the HSE guidance. Okay, basically, I hope we're all clear now about transmission routes. There's lots of links around the side of this slide, and particularly at the bottom, there's a fairly new animation on aerosol transmission, which is really very impactful and very useful, I think. There's direct contact. If you touch people and they've got COVID that has been in droplets on their hands or whatever, and you then touch your nose and hand, eyes and mouth that can get into your body. Indirect contact, large droplet sprays. If you're within 2 to 3 meters of people, then when they're sneezing or coughing or breathing, that could splash on you, and aerosols if you're at a bigger distance. And I just want everybody to be very clear. It's absolutely incontrovertible that COVID is airborne, and that is the major method of transmission. Okay, this screen sort of summarizes everything really. The person on the left, the orangey red brown person, is an infected person. Now that person with COVID, they could be asymptomatic or they could be pre-symptomatic before their symptoms develop. They could be vaccinated, they could be 1 jab, 2 jab, they might even have the booster, although the booster does seem to cut the risk of getting infected. They could be children or adults or anybody. So anybody, and particularly as we have such a high infection rate in the community and hugely high in schools, we have to treat everybody as potentially infected. And when we breathe, even if we're breathing gently, when we're talking, when we're breathing out droplets and aerosols. If we are singing or shouting or doing aerobic activity, we're breathing out far more aerosols and droplets. And so if you look at that, you can see that person's breathing out this great big cloud, which contains droplets of different sizes. The big ones will drop to the ground, usually within 2 or 3 meters, and they can then evaporate a bit and then be recirculated. So we do have to do a certain amount of cleaning of floors and surfaces to stop that recirculation and also stop picking it up by touch. If you are as far away as you possibly can be, but at least 2 to 3 meters away from people, you're going to avoid that droplet spread. But the droplets are important if they drop on your face, and I'll come on to that in more detail in the next slide. But you can see there's this huge cloud of smaller particles. These are called aerosols, and they're particles that are between 0.1 millionths of a meter to 100 millionths of a meter. We call them aerosols because they can travel in the air in air currents like cigarette smoke, and they hang there for minutes to hours, and they linger and they build up in poorly ventilated spaces, which unfortunately applies to a great many of our classrooms. And they can then be, so you can inhale them if you're close by. Obviously, the closer you are, you will inhale, you might get splashed with droplets, or you will inhale that dense cloud of aerosols. But if you're further away, you can inhale them as well, the long range aerosols. And if you come into a room where someone who was infected has been before you, breathing in and out, you can inhale the particles that that are infected that they've left behind. So that's really, really important. And if you come into a room, that person on the left who's infected, within about 15 minutes, their infected aerosols will be everywhere in that room. So you can see from that it will be very important to have ventilation that will blow those airborne particles away, extract them, bring in fresh, clean air to keep the level of aerosols in the air down. But it would also be important for the person close to be wearing a mask to protect themselves, and also the person that's a long distance away. So 90% of COVID transmission is by aerosols. Touch does play a role, but not a lot. Beware the theatre of hygiene, using strong, harmful disinfectants. We need to clean the air more than the surfaces. Hand washing is great, keep that up, and keep up normal cleaning. But normal detergents will get rid of COVID. It's in a fatty sheath and it can be cleaned away with soap and water. Each contact with a contaminated surface has only a 1 in 10,000 risk of causing COVID. So don't get obsessed with the hygiene. The government wanted us to be obsessed with hygiene because that then made it more of a personal responsibility, and the more expensive means of controlling it, like improving ventilation and other methods, which I will talk about later, they didn't want us to focus on those. Now, the Alpha variant was more infectious than the original virus. And then when we faced that last year, and that was a big problem in schools, the Delta variant is even more infectious, produces 1,000 times more virus particles in the aerosols you breathe out. And now we have just heard that there is a new variant called Omicron. Is that right? Omicron, I think. And that is thought to be even more transmissible. So we have to reduce transmission And ventilation is one of the major ways that we can reduce transmission. This is a more detailed slide. This comes from the SAGE advisory group to the government. You can look at it in more detail later. I'll just go through it very quickly. You've got your infected person on the left not wearing a mask, an exposed person on the right not wearing a mask. And you can see the big droplets can reach that person's face, the entrance to their nose, their eyes, and their mouth. And in that way, it can get into the upper part of your respiratory tract and infect you. But it's the smaller particles, the red ones that can get drawn down deeply into your lungs that are the most important. They contain virus particles, and the more of them you inhale, the more you're likely to get infected, and the more severe your illness is likely to be. So any reduction in the number of aerosols containing virus particles in the air, the more you are going to reduce the risk of people getting infected and people getting severely infected. So that's really, really important. If you see the diagram below, you'll see the man on the left is wearing a mask now, and that means that his infected aerosols are not getting out so much. A lot of them are being stopped, not 100%, but a lot of them. All the droplets will be stopped. A lot of the aerosols will be stopped, and then they won't get to the person on the right. And so if they're both wearing masks, then the protective effect is really great. There are links on the right there, and there's a link to a really fantastic little YouTube film on how masks work, because lots and lots of people will tell you masks don't work, they're useless. And that's not true. The cloth masks are not PPE. I'll come on to that in a bit more detail. But they can reduce the viral load by up to 50%. And the better they are, the better they fit, the better their filtration, the more they will be effective. In schools in America, those schools that have kept mask wearing up have 4 times less infection than those that don't. Just to be clear, ventilation has more effect on the long range aerosols than it does on the short range aerosols. And it doesn't have any effect really on the big droplets because they're too heavy to be blown away. But there's recent evidence to show that ventilation does also affect the short range aerosols. I'm not going to go into this slide about all the information about your activities, the size of your rooms, the number of people in them, what the ventilation is like, what you're doing, has to be fed into a risk assessment by law. And all I'm going to say is that if you look at that risk matrix, and if you go from the top left corner to the bottom right corner, you're going from the least risk, where people are outside at a distance, fewer people, really good ventilation, and if they're wearing masks or not doing anything very active, then you're looking at very low risk. Right down to the bottom, which represents more of the situation in our classrooms, where we're looking at lots of people indoors, poor ventilation, crowded, people close together, and no masks and poor ventilation. And then you have to use the risk control hierarchy. You have to carry out a proper risk assessment, and then the risk control hierarchy goes from collective protection to individual protection. So you eliminate the risk, and the risk is people with COVID. So you try to make sure people with COVID, people who are infected, are caught by testing, and they stay at home. People work from home. There's support for people to do that. You stop people coming into the workplace. You stop contacts coming into the workplace. And I know that's almost impossible at the moment because the government has changed the rules on all of that. That makes it very, very unsafe. We can obviously try and do things in a different way. We could teach outside. Well, we're in the winter now, and obviously we can't really do that. We can use engineering controls. We can isolate the hazard. We can try and we can use source control masks, good ventilation, filter the air, and so on. All those sorts of things. I've added screens in there for droplets. Screens are something that are only useful in certain circumstances, and in classrooms they would be completely wrong, and they interfere with the airflow, and they can actually make things worse. The last resort is PPE. If you can't control or eliminate or control the risk by all those previous methods, then workers must have PPE. And we think we've got to the stage now, and we have been recommending for some time, that teachers particularly and all staff in schools are not being protected enough, and so they should be wearing proper PPE, respiratory protection at FFP2 FFP3 standard, and the employer must provide them and must face fit them, and they must be provided free. There are problems obviously with speaking and all the rest of it, and we can talk about that. We know ventilation works. Only 1 in 1,000 cases of COVID are caught outside. We know that. And the ventilation rate, how important that is shown there on the right by, you know, if you've got 6 air changes an hour, you've got great ventilation. And if it's under 3, then you've got much higher risk. And unfortunately, that's the case in most of our workplaces. This just shows you how ventilation works. The woman on the right comes into a room without ventilation, her droplets will fall to the ground. The man on the left is far enough away not to be splashed by her droplets, but her aerosols will spread in the air and he may be infected whatever distance away he is if he's in that same room sharing that air. And on the left, it just shows the ventilation is on. Her droplets still fall to the ground because ventilation doesn't affect them, but the air is being exchanged rapidly. The air containing her infected aerosols is being sucked out, fresh air is being brought in, so the man on the left is protected. These are just examples just to show how effective masks are, and it is about fit and filtration and about wearing them. So wearing a mask inside all the time is absolutely essential, and workers should be wearing PPE. And I'm just not going to go through these, but these are just quite useful, showing the difference between the risk, how long you can be exposed, and the risk of catching Delta when you're wearing nothing at all, right up to when you're wearing an N95 mask. That's the equivalent of an FFP2 mask. Right, the law very clearly says that employers have to be identifying the risk of COVID transmission and preventing it. The Department of Education and any government guidance is guidance. It doesn't trump health and safety law. Health and safety law is what employers need to comply with. And we've obviously got things under the Health and Safety at Work Act, the management of health and safety at work regulations, the workplace regs specifically on ventilation, and the control of substances hazardous to health, which controls biological agents like COVID. And we have these safety reps and safety committees regs, which give workers huge amounts of rights to tackle all these issues and get information from employers, to be involved in risk assessments, to challenge issues, to get the information about the ventilation system and all the rest. And we need to treat COVID like any other hazard, as we would, and deal with it as a trade union in that way. You know, work out what the problem is, you know, identify the hazard and where it's most risk of exposure, and then work out action, educate members, agitate, give out information, collectively organise to do something about it. So what ventilation standards are we trying to achieve? It isn't now about just, well, open a window and it'll be all right, because we know that's actually not the case. So ventilation is measured in 2 ways, by litres per person per second, and also in room changes per hour, air changes per hour. You need to be aware of both, because both are actually used, and your employers may try to bamboozle you with these. The health and safety and welfare at work regulations, the law says you have to have sufficient ventilation, fresh purified air. You have to have that. The guidance, which isn't the law, but it's giving guidance to employers about how to meet the law. Before COVID, that guidance specified 5 to 8 litres per person of fresh or purified air. But now CIBSE, which the HSE refers everybody to, which is the Chartered Institute of Building Service Engineers, they recommend for COVID, classrooms and offices should have 10 litres per person per second. And that's important. That's what we're trying to, and experts will say that that is the level of ventilation, 10 litres per person per second, that will actually keep the CO2 level below 800 parts per million. So that will be important in terms of measuring, and why that's CO2 monitoring is important. WHO recommends 6 air changes an hour. Some experts say much higher, 9 to 10 air changes an hour. But if there was only 1 air change an hour, that would mean it would take 3 hours to remove a pollutant that was in the air. And if COVID is being released continuously, you can see how dangerous that is. If you have a higher airflow, 6 air changes an hour, it would only take 30 minutes. So that just shows you how important ventilation is. Essentially, the more ventilation, the better. But we have a problem with thermal comfort, and it's winter now, and we have a real problem with this. And that means we're going to have to do a lot of work on re-engineering all of this and developing heat recovery ventilation systems so we can have good ventilation and good thermal comfort. At the moment, we have to make decisions about what's more important. Is it more important to prevent COVID, or is it more important to be warm, unfortunately? But it also means we're going to have to look at other ways of cleaning the air. And I will come on to that in a moment. But essentially, the fewer people, more fresh air in a room. Half the number of people in a room, twice as much air. Bigger room, more air per person. All that sort of thing. Okay, so I'm going to go on to that in a minute. But just to remind you that ventilation works. I'm quite old and I remember TB and TB hospitals. And the ventilation in TB hospitals was absolutely incredible. It was, you know, sort of like gale force. People were all outside, all the windows were open. And in that way, they prevented infected people with TB passing it on to people who weren't infected. And it works now. In Taiwan recently, there was an outbreak of TB in a university. They measured the ventilation and it was very poor. The level of CO2 was up to 3,000 parts per million. They improved the ventilation, reduced the CO2 level to under 600, and they just stopped the epidemic like that. Okay, so CO2 monitors. Hopefully you're beginning to get them. They should be being rolled out, but the type you should have is a non-dispersive infrared monitor, an NDIR monitor. And you really need one that allows you to download the information over a day or over a week so that you can actually plot it out into a graph. But if you've got one in your classroom, you need to have it there for a representative amount of time that actually shows, depending on what the ventilation is like in your classroom, whether it's a mechanical system or whether it's just opening the windows, you need to make sure it's a representative sort of sample of the sort of ventilation and the sort of activities going on in that classroom, so you can tell whether the ventilation is sufficient. And what you could have is your class could be, you know, taking the readings every 20 minutes or half an hour and then plotting them on graphs, and you could have them up and then you could actually compare them. But if you can download it and you can produce graphs or spreadsheets, then that will actually help to say what's going on. So CO2 is a proxy of ventilation. Keeping it as near to the outside level as possible shows that you've got airflow coming in and out well. 600 to 800 parts per million is well ventilated room, and the HSE agrees with that. We would say if it gets up to over 800 parts per million, you should be concerned. You should be acting, you should be opening more windows, opening more doors, changing your activities, maybe leaving the classroom, purging, all those sorts of things. See if those work. They may not work because, you know, it may not be enough. Over 1,000, great concern, and rooms with 1,500 parts per million, those ones shouldn't be used. The government guidance doesn't really reflect those risks. If you're using HEPA filters, then the CO2 level isn't quite so clear an indicator of the risk of infection because it's taking out some of the particles. So you can have over 1,000 parts per million. And if you look at that graph on the right, it just shows you that if you've got under 800 parts per million, that means that the air in that room only contains less than 1% of other people's rebreathed air coming straight from their lungs, are more likely to be infected. The higher the CO2 level, the higher the percentage of rebreathed air. And when you get up to 3,000 parts per million, 8% of the air has come straight from other people's lungs. Another thing about CO2 monitors you should remember is that they can be out by plus or minus 50 to 100 parts per million. I won't go into that there. Okay, so if you can't get the ventilation right, if opening windows and doors doesn't work, if the heating and air conditioning system, if you have it, only 20% of schools in the UK do have such systems. If that can't be cranked up enough, then you're going to have to think about cleaning the air. And the way of cleaning the air is using HEPA filters, high energy particulate air filters. They can be used in an air conditioning system, or they can be portable units within the room. And all they do is they're fans and they suck in the air from the room, filter out through very effective filters, filter out particles containing COVID and other things, and put cleaner air back into the room. That's all they do. And they're 99% effective at filtering out the tiny particles. we would advise not using anything else. Don't use ozone. It's a respiratory irritant. Nobody knows if it works. It's not a good idea. Ultraviolet C radiation might be okay right up at the top of the room in a specialized system, properly installed, but not at a low level where people are. Avoid anything that says purifiers, plasma, ionizers, ozonators, needlepoint bipolar ionization, all of those things. They can add chemicals to the air. They may be ineffective anyway. They may make things worse. They've not been tested and they're not regulated. So portable HEPA filters, they like then. There's a sort of drawing of one there. It can be the size of a shredder or a small bin, and they filter out, as I've said, they just filter out the tiny particles that we're interested in that contain the most COVID. That's what we want them to do. You have to work out what clean air delivery rate, because they have to have enough capacity to clean the air in a room. If you buy too small a one, then that won't be effective at all. So essentially, there are ways of calculating it, and you know, you can find them, or they will come with the HEPA filter, and essentially try and buy the highest one you can afford. They've got to be low enough noise so you can teach. So there's some example of the decibels you should go for, and that might mean having 2 lower capacity filters so you can run them at a lower fan setting. And check things like the replacement filters and how often they need changing. And at the bottom there's some guidance on that. The Irish government produced some really good guidance on this. SAGE has some advice, CIBSE has some advice, and the Clean Air Crew has some advice. There's also a do-it-yourself sort of air filter movement sort of taking place in the UK. In America, it's much more common. It's called the Corsi-Rosenthal box, named after Richard Corsi and Jim Rosenthal, who developed it. And essentially, it's just a fan and 4 filters. And they say, if you can wrap a box with a Christmas present, you can make this in 15 minutes. In America, you can get all these components very cheaply from Walmart. And it's much cheaper than the commercial methods. It's been tested by them. If you follow their methods, it will work, and it has a higher clean air delivery rate. Unfortunately, in the UK, we don't have access to all these components as cheaply. So there are lots of people working on this through the World Health Network, through clean fresh air schools, through Clean Air Crew. A whole range of people are working on these things, trying to provide information about, you know, how we can do these things and what components we should use, and testing them. What we need to do, no one method, there's no silver bullet. So employers need to be implementing multiple layered control measures. There's no silver bullet. If you have no interventions, that's the maximum risk. If you have source control masks, you can cut the aerosols in the air by up to 50%. If you have ventilation and filtration, you can cut the long range aerosols by over 90% and the short range ones by a certain amount. If everybody wears masks, then you can reduce the effect of the short range and the long range ones. Hygiene has an effect, but it doesn't tend to reduce the aerosols in the air very much. Put them all together and it makes a massive difference. And at the bottom there are links to modeling tools which show you can feed into those tools the size and volume of your room, the number of people in it, what you're doing, and it will help to work out, what is the risk, what is the ventilation, what it needs to be. The last one in that, the BOHS, British Occupational Hygiene Society model, is quite a good one. It's hard to measure ventilation, but it can be done, and your employers should have competent people who can do that. But this model is quite simple. You feed in the dimensions of your room, the number of people in it, what they're doing, and it will tell, and what ventilation system is, and it will tell you whether it's likely to be okay or not. And another way of looking at the multiple layered preventions is the Swiss cheese method. There are holes in each prevention, but if you have them all together, it will protect us. And basically, there is joint union checklists on ventilation, which you are part of. There are questions that you can ask your employers, and this is a Federation of European Heating Ventilation checklist. There's loads of things. And remember, you don't have to be an expert. You gather the evidence, you carry out the monitoring. You ask your employer to do ventilation audits, to tell you what the airflow levels are, to monitor the carbon dioxide levels, and what measures should be taken into place. Make sure you're asking for the risk assessments, that you're involved in that, and you're challenging them the whole time. When they say no need to worry, you have to say, give us the proof on that. Okay, so that's really all I wanted to say. I'm sorry I've gone on a bit, but you can have those slides, and I hope that answers a lot of questions that people might have.
Wow, wow, wow. I'm just blown away by the information there. Absolutely amazing. I see Delma has written into the chat box if we can get a copy of the PowerPoint. So Heidi or Wayne, I'm hoping we'll be able to email that out to all participants, Hilda, if that's
Shall I just give you, I'll put the link, the Google link in the chat now.
Fantastic. Thank you so much. If anybody has any questions, if you'd like to hop them into the question box, I have one in from Raymond Beggs, Hilda. The question is, with Christmas assessments in post-primary schools coming up in the next few weeks, how safe is it to be putting whole year groups of 100+ teenagers into a school gym or an assembly hall for over 1 hour with individual tables a metre apart?
Very, very unsafe, very risky. You'd have to look at the ventilation. Obviously, if you're talking about, you know, a large room, it's possible that the ventilation in there might be sufficient to do that. But you can use all the information that I've given you, those tools that I've given you. You can use that BOHS one to actually work out whether that ventilation is likely to be okay. But even in that area, I think the desks should be much further apart than 1 meter. And even so, in that circumstance, all those children should still be wearing good source control masks, and the teachers, the staff, the invigilators in those rooms should all be wearing FFP2 or 3 at a minimum. It's a question of risk assessment. It always comes back to risk assessment, but as you can see from everything I've told you, because it's airborne, that's likely to be a risk. And even though it's a very, very big room, we don't know what the ventilation is like in that room. So you need to have that information from your employer. They have to get competent, you know, Chartered Institute of Building Service Engineers, you know, advice, or occupational hygienist advice, or measure the ventilation in those rooms to actually be able to assure you that there is ventilation at a rate of liters per person per second, which we think works, and that it's working all the way through that room. Quite often in rooms you have sort of dead spaces, so you know, you can have very poor ventilation in one area where it's likely that you know, the aerosols and COVID could actually build up. And if you've got 100 children, given the infection rate in the community, that could be half a dozen potentially infected people. So you've got, you know, sources being brought into that room, and you'd have to have very high control measures. And it may be that it would be, when you've done that whole risk assessment, it may be that it's decided that you have to do it in only 50s or something, and they have to be further apart. But it's all comes back to feeding the information and the knowledge and the science into that risk assessment. I hope that answers that.
Thank you. Richard, I saw you raised your hand. I'm not sure if that was a question. It's just we won't be able to hear you. So if you do have a question, if you want to pop it into the question and answer. But Hilda, just to let you know, the comments that are coming through on the chat, just great presentation, scary stuff. I think that is certainly the feeling from teachers, just how scary this all is. But great presentation, so informative. Many thanks, excellent presentation and source materials. So it's certainly been very useful.
I hope so, and I know it is scary, but the point is, if we are informed, we know there are things we can do. As I've made, you know, I hope I haven't tried to be too negative, but there are lots of things we can do. It's a question of, you know, accepting the real risk, you know, assessing the real risk, and then getting on with the preventions.
Yeah. There are no further questions coming into the question box. I'll just give that another minute just in case someone is typing. I don't want to cut them off.
If people have questions later, you can always send them to me and I will answer them.
Thank you, Hilda. Really appreciate that. Fantastic. Okay, well, that is our first workshop finished then on ventilation. So we're having a break again on to 12:10 when we will be back for our practical guide to risk assessment. So just if anybody had difficulty getting in the last time, it's a separate link for each one of the sessions. So if you can check over your program and use the link to join into each session. And I will see you back again at 12:10. And Hilda, again, thank you so much for taking the time this morning to speak to us. And it's been certainly very informative. Thank you.
Thank you all and good luck.